In Africa, we carry 24% of the global disease burden, and yet we are home to only 3% of the global healthcare workforce. When that is our reality, then we really do have to look at how can we make sure that we are making full use of the limited human resource for health that we have available. Many of our African countries, aside from the shortage of specialists, they'll be based in urban areas. And yet our populations are out in the rural areas. So by leveraging technology, it becomes possible to connect specialists with frontline healthcare workers so that there's that knowledge transfer, there's that hand-holding, there's that virtual mentorship so that patients can be seen as close to their communities as possible. We talk about moving knowledge instead of moving people, so that if patients can be seen as close to their communities as possible, it saves a lot of time, a lot of energy, transportation. Prevention is better than cure. It's cheaper, it's more cost effective.
DRC was so fortunate that President Tshisekedi, after he came to power in 2019, he started talking about universal health coverage and digital transformation. We had a presidential program talking about universal health coverage and digital transformation. So the president himself was very involved in day-to-day basis on following up how we are transforming our health system. One of the first challenges is electricity. Electricity is not very permanent in all the facility, so you have to find different investments on permanent electricity. So that's one of the challenges. The other challenge is the quality of internet connectivity, because for real-time data you need permanent internet connectivity or very stable. That's also one of the challenge. The third challenge is human resources. The human resources capacity is very low. That's why the government is also investing in training the health workers on using different digital platforms.
People are receiving services, and that information starts to move. Who provides approval that Dr. X, clinician Y, can access this information? And so this is going to be very, very key, that consent mechanisms are built in, and that ownership of data stays with the individual, and that they're the ones saying, yes, I want to opt into your telehealth service. I give you approval to access my data and to share it with X provider across borders.
Right now, as we speak, we are leading on a project that's working with national public health institutes on collaborative surveillance to make sure that disease outbreaks can be identified as early as possible, they can be reported as quickly as possible, they can be contained as quickly as possible.